Hi, I'm Dr. Sheila Reyes from the Philippines, and I'm here at Washington, D.C. reporting live for Room Now at the ACR Convergence 2024. I'm joined this afternoon by Dr. Denis Poddubnyy from the University of Toronto, where he will be talking about abstract number 819 regarding the newest definition of difficult to manage axial spondyloarthritis. So, Professor Poddubnyy, thank you for joining us this afternoon, and congratulations on your paper. So could you walk us along how the criteria came about, or the definition, what criteria you used, or how you came about with the consensus definition?
Well, that was a long process. Took about 3 years in total to find a consensus among experts on what difficult to manage spondyloarthritis is about. So we started this initiative some time ago, and there was clear there is an unmet need in the field. We see every day patients coming to us not responding to the most advanced treatment. And rheumatologists are very well aware of various problems which might lead into treatment non-response or insufficient response to the therapy. It can be a biological non-response, so inflammation is not controlled well, but more commonly these are other problems like chronic pain not related to inflammation, so-called nociplastic or neuropathic pain. It might be a bit surprising, but this fact is not really reflected in the management guidelines. If you look into the management guidelines, you will see that in a patient who is not responding to the treatment, the recommendation is to check the diagnosis and to change the treatment. But the problem is much deeper, so you need to understand what is the structure of reasons behind this treatment non-response. So that is why we decided to develop this consensus definition to define the group clearly, to be able to study this. And in addition to that, and that was a development during the whole process, we came across a definition of a narrow, smaller group of truly treatment refractory patients, so patients where we have uncontrolled inflammation despite effective or presumably effective anti-inflammatory treatment.
Okay, thank you. So it's also interesting to note because it's giving more of a practical application that we can also use clinical in our clinics, right, and not just in research as defining difficult to manage spondyloarthritis. Yeah.
I think this is a first important step on that ways. We certainly will need to study these patients, difficult to manage patients, to understand what is the best approach, how to address all the problems outside of inflammation, to find an appropriate way how to manage those patients. I think many rheumatologists, they have ideas how to deal with those patients, how to manage pain in these patients, but there is no unified approach. This is something that will come as a next step.
It's the next step, okay. So before we wrap up, could you give us the different elements, the important elements of the definition that you came up with?
Absolutely. So there are three main pillars in that definition. First is a history of treatment with sufficient number of advanced treatment options. In the case of axial spondyloarthritis, we define that as a history of at least 2 biological or targeted synthetic DMARDs, given an appropriate amount of time to see a response. Second pillar is presence of signs and symptoms indicative of uncontrolled disease. That can be defined by a composite outcome measure like ASDAS. It can be defined by the presence of symptoms such as fatigue, extramuscular skeletal manifestations. It can be defined by rapid structural damage progression, or it can be defined even by other symptoms not mentioned here, but still bothering the patient. And of course, it can be uncontrolled inflammation as reflected by CRP or MRI. And then the third pillar is that this situation, so having signs and symptoms with a history of previous treatment, is perceived as problematic by a physician and or by a patient. So all three should be fulfilled cumulatively, and then we can talk about difficult to manage situation. Treatment refractory is a fraction of this big patient population, difficult to manage population, where we ask for true treatment failure and presence of objective signs of inflammatory activities as obligatory criteria.
Okay, all right. So thank you very much for giving us insights on the new on the definition of difficult to manage and the refractory type of spondyloarthritis. And hopefully we get to know more about or we get to use the definition, and also that will help us in the management of our patients, and also control disease activity and even improve quality of life. Okay, so there you have it. Tune in to Room Now for more updates and news of on the ACR Convergence 2024. Follow me on Twitter at Rumarampa, and have a good day.